I'll give you 2 minutes background or 5 minutes background about what I do in New York and here, and then figure that I will answer questions for the rest of the time. I'm a physician in internal medicine in New York, meaning I'm a primary care doctor or a regular, like a family doctor. I've been doing that for about 25 years, and I've also been, for the majority of that time, doing most of my time on research to help improve healthcare delivery in the U.S. My biggest interest has been preventive medicine, in particular, how do I reorganize healthcare in the U.S. to make things work better, to get people to smoke less, exercise more, eat better. In particular, while I started off initially doing research on exercise, I pretty early on changed over to smoking cessation, helping healthcare systems do better at getting their people who use tobacco to quit, both for getting the patients to be more interested in quitting and the doctors to do a better job of counseling them. One of the great things about that is I never have to convince anybody that I'm doing a good thing, because in the U.S., everybody knows that tobacco is bad. It's been... I never get the reaction at all that when I tell somebody that smoking's bad for them, they go, "It is?" We all know it. And people persist for a lot of different reasons. And I find that if I can design the system or redesign it to make people's time easier quitting, I get more people to quit. So the grants that I've had in the U.S., and I've been doing research funded by federal grants for 20 years now, the grants that I've had in the U.S. have really focused on making it easier for doctors to prescribe medications for smoking cessation, making it easier so they can spend less time counseling but still get the same good results, helping to connect people to state telephone counseling lines, what we would call quit lines in the United States, and things like that. One of the interesting things which will lead into the research here is that in the U.S., particularly in New York City where I'm based, cigarette smoking has dropped dramatically. It's gone from a high of 40-50% in the 1960s down to, I believe, below 20% now. New York City has gone from 21% about 8 years ago down to 14% now. So only 1 in 7 people, adults in New York City, smoke cigarettes. But at the same time, what's increased dramatically is the use of alternative tobacco products, which have doubled or even quadrupled over the last several years. And by that, I mean electronic cigarettes and water pipe tobacco. Each has a different audience, but we've been doing a lot of research, not just on how to get people to quit smoking, but on the health effects of alternative tobacco products and how to get people to stop using them. NYU has had a campus here in Abu Dhabi for about 5 years now. We graduated our first class of students, of undergraduates, this past year. And as part of the campus, they've had a series of research grant proposals for NYU faculty. And as part of that, I, together with a bunch of colleagues, I applied for one of the grants and am one of the leaders on the NYU Abu Dhabi Public Health Research Center. We've been coming here for about 3 years for that center. I think this is my 15th or 18th trip here in the last 3 years, something on that order. There's a lot of trips back and forth. And part of my public health research center is focused on tobacco, but the bigger part is that we're doing a cohort study of 20,000 Emiratis. We just started in December at the beginning of it, and we plan to recruit 20,000 people over the next 3 years, all citizens, and that will allow us to look at the determinants of cardiovascular disease and diabetes. There have been a lot of cohort studies like this in the U.S. and in Europe. I worked at the Framingham Heart Study for a year, which was one of the first large cohort studies. There's similar ones in Europe, such as the UK Biobank, but ours is one of the first ones in the region, and at 20,000 it'll be one of the largest. And that'll give us a lot of ability to say whether the things that lead to death and disability in the West are the same causes here. They may be, and in some cases they may not be. as part of that cohort of 20,000, we have a substantial number of questions on tobacco use, because tobacco use is common here as it is throughout much of the world. The patterns are different than in the US, and that's been very interesting for us. So within this Public Health Research Center, we have 4 different centers, one of which I also lead, which is the Tobacco Control Research Center. And that's been focused on a bunch of smaller projects here, looking at the prevalence of different types of tobacco use, knowledge, beliefs, and attitudes around those types of tobacco, and what we might do about it. Some interesting things to note here that differ for what I'm used to in the US or in Europe. Here, cigarette smoking is really only among men. We just finished recruiting 400 people for the pilot for our cohort study, and among about 250 men, the prevalence of smoking was about 20%. Among the 150 women, not a single one reported smoking cigarettes. It may be that some of them smoke but aren't comfortable telling it because it's not socially acceptable here for Emirati women to smoke cigarettes, and that's been an issue for us in the U.S. and that there's plenty of populations where smoking isn't generally acceptable, and you worry that people aren't necessarily going to tell you the right answer. But that's the pattern that we've seen so far, is the prevalence of cigarette smoking similar to the U.S. or Europe, well, some countries in Europe, and very low among women for cigarettes. Similarly, water pipe is prevalent among men here, and none of the women reported using that. And then there's a third type of tobacco here called dokha, which I usually see spelled D-O-K-H-A. If I understand right, that's Arabic for the word dizzy, because when you smoke it, it gives you a rush and the person feels a bit dizzy. It's common to the Persian Gulf and smoked in a pipe called a midwach. And people among the 250 men in our cohort study in the pilot, 21% reported using that. So even a shade more than reported cigarettes. The previous study that had looked at it also showed it was the second most common form of tobacco used among men here. And what's different about it, it's smoked in this pipe. And unlike a cigarette, which might take several minutes for somebody to smoke, here somebody gets an equivalent amount of tobacco in 1 or 2 puffs. When I was here last month with some students, we went on a desert safari, and every half hour or hour, the driver would get out, take out his midwalk pipe, put some tobacco in, and I wasn't sure that made us more comfortable being in the car with him driving crazily around sand dunes, but it is very common.
Is it the hookah?
So this is different from hookah. So
is it like cod in Yemen?
I don't think so.
No. What's the name?
Cod is a hallucinogen.
Dokha is the tobacco and smoked in a midwach pipe.
Yeah, but how do you spell it?
D-O-K-H-A, and the pipe we usually spell M-I-D-W-A-K-H. What's interesting is if I look at the scientific literature, there are probably 200,000-300,000 publications on cigarette smoking and all the bad things about it and the factors associated with it. When we looked a year or so ago, there were maybe 300 or 400 articles on water pipe or shisha. At that time there were 3 on dokha, despite the fact that this is the second most common form of tobacco here. We've since published one, and other people published a couple other articles, but pretty crazy to have in our study, the most common form of tobacco, and there's really nothing known about it. So that's part of what our Tobacco Control Research Center is doing. We have a couple of different surveys going on about dokha, and you'll hear about one of them from one of the students this afternoon, from Lakshmi Menon. We have another study that's going on, working together with us at Gulf Medical University, where they've been looking at the biological effects. So what is somebody's blood pressure before and after smoking this? Does it affect their lung function? We plan to do focus groups, bring people together who use this to say, what makes you do this rather than cigarettes or water pipe? Are you interested in quitting? as part of our center, we just finished a different project with students from New York. They were the ones who were here in January, doing both a survey of students at UAE University and NYU Abu Dhabi, and also focus groups, looking again at factors, but this time related to water pipe tobacco. Heard lots of interesting things about what leads them to smoke water pipe, what they thought might get them to quit, and it is very different for them from cigarettes. One of the students said, "Yeah, we all know water pipe is bad, but I only do it once a month, and I know I shouldn't eat 3 pieces of cake, but I do that once a month too." So when we talked about getting them to quit water pipe, they were all like, "Why? We're not doing it that often. I drive too fast every once in a while too. I should probably quit that, but I haven't gotten around to it." So it makes us think that maybe a different word than quit is necessary. Maybe I want people to cut down from once every 2 weeks to once every 6 months if they won't stop altogether. But that's the type of research we're doing, sort of looking at the knowledge, attitudes, beliefs associated with these products, the harm that seems to come from it, and see what we can do from there. I'll mention a couple of other projects that we just completed. One was also related to water pipe tobacco. My colleague, Dr. Michael Weitzman and Terry Gordon, worked together with a physician in Dubai, Dr. Afzal Yusuf Ali, and went into the homes of 30 people, 30 families in Dubai, 10 families that smoked water pipe, 10 families that smoked cigarettes, and 10 families that didn't smoke at all. And they measured the air quality in those homes, both in the room that the people smoke in the room where the children play, and they haven't analyzed the room where the children play yet. But from talking with Dr. Weitzman last night, the room that the people smoke in the air quality was hazardous. We have a scale in the U.S. from the Environmental Protection Agency, which ranges from good quality all the way up to hazardous. And when Dr. Weitzman and Dr. Gordon have done studies in hookah bars in New York City, the air quality has been hazardous to very hazardous, and the air in the homes that they measured was at least as bad, if not worse. Makes me think that it's likely that some of that will be in the rooms the next room or two over where the children are playing, and that would be really helpful information. What I've seen over 20 years of tobacco control in the U.S. is people often are very and they smoke even though they know it's bad. I hear from my patients, "Gotta die of something." But then when they hear that their spouse is getting sick, or their children or their grandchildren, that's a big thing, and that's gotten a lot of people to quit. So we're hoping that we're able to get data like that for water pipe, because that might be a big way to motivate families not to do this. We had done a study last year where we went into hookah bars in New York, Abu Dhabi, and Dubai, interviewing the business owner, and it was striking to me seeing families there sitting there with the father smoking, and there's all the kids around the table, all breathing in the air. So that was most of what I wanted to say, that I'm passionate about getting people to quit tobacco, because this is the leading preventable cause of death in the United States and throughout much of the world. Tobacco is on target to cause 1 billion deaths in this century. And mostly, tobacco use is perpetuated by greed. Companies make lots and lots of money off of tobacco. And if they're doing it at the expense of the people who are dying from it. So I think anything that we can do to help mitigate or decrease that death toll would be wonderful. So that's all I have.
Can I ask a question? You've mentioned that you've been doing a research about the shisha, about the water pipe. I'm sure it involves all the effects that it has on health, right? But also I would like to know about the flavorings, because we've been hearing that even the flavorings can cause cancer too.
I don't know if
do you have any information about that?
I don't know if they. I don't. So a little bit, not to answer the second part of your question. I know I don't know of anything showing that the flavorings cause cancer. I do know a couple things. So one is my colleague in Florida, Dr. Wasim Maziak, has been one of the leaders in this water pipe epidemic and doing research on it. And he's published data and suggests that a lot of the increase in water pipe tobacco use, which started back around the 90s, was due to the introduction of flavored water pipe tobacco. Prior to that, water pipe was mostly older men. And now, if you look at hookah bars, which have become global, in New York City, when we think there's probably between 200 and 300 listed right now, and there's probably more places that sell water pipe that aren't in that list. It's young men and women doing it, and I think I do agree with him that that's probably due to the advent of flavored tobacco. The other thing that's been interesting is when we went around interviewing water pipe owners or managers last year, is that they all bragged about the flavors that they had, not just the flavor of the water pipe, of the shisha, the tobacco, but now they all like, oh yes, we put a watermelon on top of our hookah, or a grapefruit, or a pineapple. And they all say, oh, it makes it smoother, it makes it taste better.
Healthier.
Yeah, exactly. Well, and that's an interesting thing, because a lot of the perception among college students, and this is often marketed around college campuses in the U.S., is that water pipe is not dangerous because it goes through water.
Yeah.
And that's not true.
How can you access to that study, that research of your colleague?
I'm sorry?
Can we access to that study, to that research?
Which one?
From your, I don't know, a colleague of yours from New York. I
The
remember the name.
So the one that Dr. Michael Weitzman is presenting at the conference about the hookah bar in people's homes.
Oh, okay.
I don't think his one in hookah bars has come out yet. I think it's under review right now.
Oh,
But he has an oral presentation about this air quality in people's homes.
okay. Thank you.
You're welcome.
Can I ask a question? I mean, do you think we'll ever get to the point in the Middle East specifically where water pipe would be completely banned? And I mean, how do you get people to quit something that's so ingrained in society? Like, you know, in the US or in Australia, it's part of our culture to go out for a drink, you know, after work. And similarly in Lebanon, everyone's smoking it all the time.
It's a tough problem that it takes not just change in the price, which is often helpful, but a change in the laws, a change in the policy, and a change in cultural attitudes. There's tons of examples of different parts of that. In New York City right now, it's not just that a pack of cigarettes is $12.50, that it's become uncool to smoke. Then it's not easy to be a smoker in New York City. In Ireland, a pack of cigarettes is also about $12.50, and people said that they'd never be able to go smoke-free in Ireland, yet they did. However, I don't think the culture has changed as much, and the prevalence hasn't come down that much. So when my family and I were in Dublin 2 years ago, we would go to a pub, and you'd see everybody smoking right outside the door.
Yeah.
So it doesn't seem to have changed much there. I've heard mixed things here in the Middle East about this being part of the culture or this not being part of the culture. If you talk, and like I mentioned with water pipe, it really wasn't prevalent like this before. It was mostly older men using it, and that's not the pattern you're seeing now. Similarly, when we did the focus groups here at NYU Abu Dhabi, everybody sort of felt like it was part of somebody else's culture. The Abu Dhabi students said, well, it's not really our culture. That was the students from UAE University. The students from NYU Abu Dhabi didn't smoke shisha before coming here, and many, if not all of them, had tried it here. So it seems to be catching on dramatically, but I'm not sure that it has to be that way. It wasn't always like this. And Australia is a great example because Australia and New Zealand have been some of the leaders at cutting the prevalence of smoking by making it expensive, making it difficult, and making it not glamorous anymore. And they've done a tremendous job.
Cigarettes in Australia are like $25
And
now.
Australia's,
No one can afford to smoke.
US dollars?
Like 18, 19 US dollars a packet.
and not only have they put on graphic labels on packs that show horrible pictures of things that happen when you're smoking, they've also passed a law that we tried to pass in New York, and we tried to get the graphic labels on, and we're having trouble with it. But there's now plain packaging. You can't have any logo displayed on the cigarettes in Australia. So Camel can't look any different than Marlboro or any other brands, to try and take away the marketing aspect of it.
I'd be interested in this thing you just explained as the third most political type of tobacco here in the Middle East or in the United Emirates in that sense. This is something new to me, and I would like to know whether it's a new wave, it's coming into fashion. Is it some traditional thing that people are going back to, trying to revive their roots or so on? Because as far as I know, this was something widespread among Bedouin tribes in the old times, and maybe they are trying in such a way to be more kind of traditional. And the other reason I asked you that question is that, I'm from Russia, and we have a huge Muslim population. And after the Soviet Union collapsed and Iron Curtain fell, people turned back to religion, because during the Soviet era it was prohibited, everybody was atheistic, as you probably know. So now everybody's turning towards the religion. And if you look into the North Caucasus, what's going on is women are trying to cover up in the Middle Eastern style, Muslim women. Men are growing berets, because that's one of the attributes that, that's a must for Muslims. And they're also copying some latest trends from here, from the Middle East. So do you think this is a traditional thing here, trying to be more Arab, more Muslim, more kind of cultural, that could be derived by the people, by the Muslim in the North Caucasus or anywhere else in the world?
So we've been very curious about that. I had never heard of this tobacco before 3 years ago, and then to see that it's the second most common form of tobacco used here in the country. Second most common. In our survey that we completed, it was roughly 20% cigarettes among men, 20% docha, 21%, and I think about 10% hookah, so second most common. There was a large survey done by the Health Authority of Abu Dhabi where they had 95% of all adults, and this was published a few years ago. And that found that's where that was the second most common form. That docha smoking was more common than water pipe in the country here. So the origins are that it was carried around by sailors over the last several hundred years ago around the Arabian Gulf. I'm a little bit less worried about it spreading, because right now it seems to be prevalent just around the Persian Gulf countries. So when I talk to people in Qatar, they say that it's very common there. Same thing in Kuwait. Some of the docha itself is manufactured primarily, from what I can see, in UAE and in Iran. But it's hard to know figures because nobody's asked about it. And so is it that it's not prevalent elsewhere, or that nobody's asking?
That's why I'm asking.
So I suspect it's more that it's not that it's not prevalent. We did some preliminary stuff which isn't published. I had a colleague here at UAE University who was visiting from the U.S. and he said, "Oh yeah, I saw this in drug treatment programs in California." So we did a search using Google Trends, which is a nice way to see what people are searching for. Because when we do that for hookah bars, it lights up all over the U.S. and all over the world. When we do that for docha, it really just lights up right around here. That really nobody in the U.S. is searching for docha, nobody in Russia. So I don't think that it's spread. if somebody had asked in 1985 about hookah, the answer would have been the same. They don't think it's spread because it was predominantly the Middle East, but that changed. So nobody ever knows what's going to catch on the next time. But right now, my guess, and it's just a guess because, as I said, there's no literature, is that it's just this region around the Gulf.
Any tendency it might spread further?
Don't know that. And from what we can see, it's harmful. That the people don't do just once a day, but that people do this 10, 20, even 30 times a day, similar to the way people might smoke cigarettes, where a pack a day is 20 cigarettes. And it's tobacco, so I'm sure that this is harmful. So they're not getting dizzy from nothing.
You indicated that most of the doha is manufactured here and in Iran. I'm wondering who's making the tobacco that goes into the water pipes, and whether, given the consolidation of the tobacco industry around the world, we heard earlier that some 5 countries control 70% of the tobacco sold in the world or something. I just wonder how much influence the big tobacco companies have on the spread of these various types of tobacco. Because if it's manufactured locally and big tobacco companies are not making and marketing it elsewhere, and maybe there's a possibility that they're going to come into this market as well.
It's a great question. Again, for Doha, nobody really knows. So let me answer that with regard to water pipe, because that's the global one right now. When we did this business survey last year, about half the places that we went to were franchises with multiple locations, and half were not. More common to have franchises here in the Middle East, in Abu Dhabi and Dubai. But most of the places, particularly in New York and elsewhere, we see are not franchises. They're little, sort of an individual water pipe cafe, which affects marketing and stuff like that. You don't get the same billion-dollar advertising budget if it's just somebody's little hookah bar right down the street. Most of them said they advertise, but it's usually Facebook or flyers or stuff like that.
But where does the product come from that they're selling in these little shops?
I don't know as well. A lot of it comes from the Middle East, from what I understand, because my understanding is limited to when I gave a talk on this last year on the economics of water pipe. Searching for where is the industry, and it's in China, it's in the Middle East, it's in Egypt. A lot of the factories and stuff were listed as in Egypt. It wasn't a careful search the way I'd do a review if I was writing a research article. I needed enough information to be able to be credible for the talk. And it was interesting giving the talk on the economics of water pipe. I felt very insecure because I knew almost nothing about it. But that put me ahead of everybody else in the room because nobody else knew anything about it. And this was the conference of water pipe experts, because at that point there were 0 articles published about the economics of it. That I think that most of the parts are in the manufacturers in this general region, not just the Persian Gulf, but from sort of all of the Arab world here in the Eastern Mediterranean region. But China China and India were notable for factories producing either water pipes or other things. To answer the last part of what you said is mostly it's not been multinational tobacco corporations, with the one exception that Japan Tobacco did just buy one of the larger manufacturers of water pipe tobacco. And that always worries me when the tobacco companies start getting into this, because they've had decades of selling their product.
You said it's catching on. Like we heard earlier, I think we heard yesterday, that e-cigarettes, big tobacco companies are getting into it. For cigarettes, when there's no advertising, there are paid cigarette commercials put in, not commercials, but paid cigarette stuff put into Hollywood movies. How is this catching on? How is it happening? Who is engineering it?
Who is engineering for hookah or for e-cigarettes?
No, for water pipes.
It's a good question. I don't know. Whether it's catching on. my perception, and it's just that, this is seen as a cool thing to do among young people. And I think that this is mostly people 18 to 30. That you don't, in most hookah bars, you don't see a lot of 50 or 60-year-olds. It's not the pattern of cigarettes. The stuff that we've done in the U.S., the paper that we just published last year, said this is not, unlike cigarettes, this is not low-income minority people in the U.S. or disadvantaged. This is people who are more affluent. The biggest, having a higher income was a much stronger predictor of smoking water pipe. As to why it's spreading without really a lot of marketing, e-cigarettes I can point to are spreading dramatically because just look in the U.S. at the phenomenal amount of marketing that there's been, and the bigger companies are all now owned by tobacco companies. But I can't say that about water pipe, and yet it's still spreading.
Is it seen as a safer alternative to cigarette because there's so much awareness about cigarette now in places like US?
That could be part of it, and the people that we talk to do definitely perceive it as safer. Like I mentioned before, they talk about it going through water as one rationale why it's safer, or just the perception that they do this once every week or every few weeks with friends. But yet it can be addictive, and there are certainly people who go from smoking weekly to smoking daily. As part of the focus groups here at NYU Abu Dhabi, one of the students had a friend who had gone from smoking weekly to smoking daily, and her friends all intervened to use their social influence to get their friend to cut back. So that's it. You're only allowed to do this once a week now, or else we're cutting you off. And it worked.
So today the Director of Health made a very interesting point that there is a pre-marital screening here where you actually have a form where you have to fill in whether you smoke, what kind of thing you smoke. But I was just guessing, whether that kind of data is something you can depend on, because marriages are very much a family thing, and if they have seen the form and, would you like tick, this is what I smoke, and, so is that data captured? Is that authentic?
That data is captured, but in a setting like that, it would make me much less comfortable believing it for the reasons you mentioned. In research, we always talk about a social bias, so that where there's an expected answer, you tend to get the expected answer. Right. When we did focus groups among the Emirati students here, the women commonly mentioned marriage as a big issue regarding smoking. They said that if they were perceived as smoking water pipe, they felt it might affect their chances of getting married. Someone raised an issue for me the other day. It's like, does that still apply after they've gotten married? And I don't know the answer to that. We did undergraduate students who weren't yet married. So the marriage certificate data is not one that we're using.
Right.
Is water pipe depiction allowed in movies, television series?
I think it's allowed in the U.S. I'm not positive, though. So here I don't know. And that's certainly helped in the U.S. is to eliminate advertising for cigarettes everywhere. There's been talk, I think Stanton Glantz in California and others have argued that any movie that shows smoking should be rated R in the United States, and that hasn't passed, but there's talk of doing that as a way to, again, make it less cool, because that's always the images it has in movies. People seldom show the bad effects of smoking. And that's my worry with e-cigarettes. At the tobacco research meetings that I go to, there's a series of video clips that they've shown with one movie star after another coming in smoking e-cigarettes, making it look very glamorous and very cool. And that is one of my biggest worries with electronic cigarettes, is that something that was... we're seeing what we did with cigarettes 30, 40 years ago, and people worry that could reverse decades of public health success with cigarette smoking.
Can you tell us about the profile of your students? And of course, they're young, so they want to smoke. So, what's the smoking policy in your school?
Here at NYU Abu Dhabi? I believe, and Kate can correct me, I believe that there's no smoking on campus, like our campus in New York. Certainly no smoking indoors. It's a typical student age, so the students, majority of them are going to be 18 to 22. The campus basically recruits from around the world. With, I don't know the subsequent years, but I remember reading that the 150 students in the first class came from about 40 countries. Some here from the UAE, but some from really all over the world. Kate, do you have a better, more detailed answer about the student body?
Well, I mean, I can add that our student population now, the whole student population comes from over 107 countries, I believe,
Okay.
and they speak more than 100 languages. It is a non-smoking campus.
From your research, was it focused on the native Emiratis because there's a huge population of people from outside from other countries, and how do smoking patterns differ from the native Emiratis and the population from other countries
Among the students, or just among the country here?
in the country?
So we've been very interested in both. The cohort study that I'm doing, where we're recruiting 20,000, is all Emiratis. That we considered including expatriates at the very beginning, but the health authority pointed out that the average time in country for expatriates is only 3.5 years. And since we're planning on following people for 15 or 20 years, we don't have the resources to track them down around the world. It's clear that the smoking patterns are very different among each of the different subcultures here. So the data that I mentioned about 20 to 21% cigarettes and Doha among men is just Emiratis. The pattern among Pakistanis and Bangladeshis and people from the Philippines and people from Europe is different. And 80 to 90% of the population here are not Emiratis. So from a public health perspective, it's equally incumbent, equally important to address tobacco use among all the different subgroups. My colleague here, Dr. Raghib Ali, who directs the Public Health Research Center that I mentioned, and together with one of the Emiratis who works with us, Ms. Aisha Al-Hamiz, are planning a text messaging intervention, not just for Emiratis, but for expatriates as well, that would build on some of the literature in smoking where text messages have been shown to help people quit smoking. And we plan to launch a study using text messages to try and get people to quit cigarettes, water pipe, and Doha among both nationals and expatriates. Otherwise, the things that have helped most here at a national perspective have been some of the clean indoor air laws. So, for instance, there are laws here banning where hookah cafes can open up. They've not, I think the current one says that you can't smoke within 100 meters or some distance like that of a residential area. And if you've seen Abu Dhabi, there's a lot of apartment buildings and a lot of residential areas, and that's made it very difficult for new hookah bars to get licensed. That would certainly not just affect nationals, but would affect everybody. The UAE has been one of the signatories, the signers on to the Framework Convention on Tobacco Control from the World Health Organization, and parts have been a tremendous success. So that has affected marketing and stuff like that. It hasn't led to taxes here like it has elsewhere, because I've been told that even though the Framework Convention calls for taxes, it's unlikely that cigarettes would be taxed because there's no taxes on anything here. And cigarettes aren't going to be the first. They can have duties on them, so import duties, which leads to higher prices, which would be a good thing, but it wouldn't be framed as a tax, most likely. But something like that's needed, particularly among the expatriate community, because you can get a pack of cigarettes for less than $1 here, I understand. Certainly different than I'm used to in New York City. And if people are coming here from other countries to make money to take back home, raising the price would certainly be likely to have a big effect on smoking.
Dr. Sherman, you mentioned that e-cigarette use is going up in New York City as an alternative to cigarettes because the taxes at the city, state, and federal level are so high. Would you believe that if they taxed e-cigs at the same rate, that people would quit using them?
It's so the scientific answer is nobody knows. I'm not sure, and it's fascinating. At the tobacco research community meeting that I went to last month in Philadelphia and the previous year, I meet perhaps a third of my colleagues who've been doing smoking cessation research for 10 or 20 years say that e-cigarettes are the best thing to happen, that they'll be a disruptive technology and they'll lead to the end of combustible tobacco. And another third say exactly the opposite. They say that these are going to be a horrible thing, that they're going to make smoking glamorous, they're going to get people who don't smoke to start smoking by going from nothing to e-cigarettes to cigarettes. And they point to the fact that the tobacco companies now own them as a nefarious thing, that they feel that tobacco companies know that that these things are not leading people to quitting smoking. That's been the hope, that this would lead people to quit smoking combustible cigarettes, and the research has been mixed. Clinically, among my patients, and although this is just anecdotal, I have a bunch who've tried e-cigarettes to get off of cigarettes, and when I see them 6 months later, they're still smoking, maybe a bit less, maybe not, and sometimes they're smoking e-cigarettes as well. So I can't really even say that it was harm reduction, because they've either just reduced a little bit or they've added something else in addition. The people who feel that e-cigarettes are a good thing wouldn't want them taxed, because that would be decreasing the use of a good thing. So it's a tremendous public health issue where there's no literature. It's a good question.
Another question, sorry. What do you think can be done to encourage governments to take action on water pipe use?
One of the interesting things, and it's been fascinating for me. 3 years ago, I knew nothing about water pipe, and really, it was coming here that it launched my interest in it and got me expert at different parts, and has led to me doing research on parts. And it's fascinating that most of the parts of the Framework Convention on Tobacco Control that I mentioned, and the laws in many countries and states, apply to cigarettes but don't apply to water pipe. And that's been a big challenge, is that, this loophole that all these things we've learned aren't being used. When we did this business survey of water pipe hookah bars, it was fascinating sitting there in New York City interviewing people who are just smoking with clouds of smoke, and they're sitting underneath a no smoking sign. Because the law says that in New York City you have to have a no smoking sign indoors, but clearly it doesn't apply to water pipe. And that's been the case in a lot of other places. I should also say that the best laws and policies don't matter if they're not enforced. And that's been the case in some countries in the region where the laws changed and nobody enforced them. Or another country that I was told where the laws changed and the hookah bar owners all decided to just ignore the law because the price of a ticket was small compared to the price, and they just passed it on to the customers. They would get a fine once a month and raise the price by a few cents or something like that. And so we've seen that in New York City, that unless things are enforced, nothing makes a difference. New York City has had a strong ban on cigarette smoking anywhere indoors, so the hookah bars were all supposed to be selling herbal tobacco, not regular tobacco, or herbal shisha. And my colleagues, Dr. Weitzman and Dr. Gordon, went in, and the 8 hookah bars they found, every single one of them they went in, they found nicotine in the air, suggesting it was tobacco. And the New York City Department of Health, together with students from one of the classes in NYU New York, did a sting operation where they went in and took some of the shisha at I think 12 different cafes, and every single one tested positive for tobacco, and then the city closed all 12 of them down. It sent a pretty strong message that tobacco was not acceptable.
I wanted to ask you, you've mentioned that that study, that research about hookah bars has not been published yet. Do you have any other research that has been published probably here? Where can we read more about that?
I can send probably the easiest thing would be for me to send a link to Kate and to Greg, and they can get it out to you all.
Yeah, I'd appreciate it.
We had one review article that we published on DOCA a few months ago. There have been some on air quality. Publishing is slow, unfortunately.
But I would appreciate
Yeah,
it.
it always there's a substantial lag from the time we finish the research, analyze the data, submit it, and then get it accepted, or sometimes submit it, get rejected several times, and then get it accepted. The one I mentioned about in people's homes, the Dr. White's 3 days ago when I talked to Dr. Weitzman, he didn't have the data yet because the analyses hadn't been done, but now they have. Now he has them, so that's as much as I do. So. Mm-hmm.
I have a couple things. Did you mention that Dr. Weissman was going to be presenting at the conference
Yes.
that we were at? So they'll have an abstract somewhere, probably on that thumb drive that they gave you. I think all the abstracts are there, and you could probably.
And I can try and send something, and I'm sure his abstract won't have the results because he didn't know them at the time. But I can try and get those out to you. Again, they're not published yet, so it's just a presentation at a scientific meeting.
That would help.
I had a question. What is the UAE government doing about restricting these shisha and hookah bars? Is there anything happening there?
It's gotten more and more enforced. I think the policy went into effect last January. There was some initial enforcement, and then there's been more and more. So it's always hard because it has financial implications, but I'm told by my colleagues here that it's very difficult for new hookah bars to open at this point. And it's been tougher on the existing ones. It's different perception on following the rules here than in New York. When we interviewed hookah bar owners in New York, they're like, well, this is the policy, but we don't always follow it. In New York, most of the hookah bars pay their workers off the books so that they don't have to pay taxes. That's what they reported to us. Whereas here, when we asked whether they follow the laws, they almost didn't understand the question. It was more like, of course. It's a very different culture here than in New York City. So I think that you get much better. Businesses are more willing to follow the policy here than in New York. Yes.
You mentioned that there's a perception that shisha or hookah is less harmful than smoking tobacco cigarettes.
Mm-hmm.
But you said, no, it's still harmful. Can you compare the harm? I mean, we keep hearing that with cigarettes you get all these additional chemicals and poisons and arsenic and whatever. So can you compare the harm of cigarettes with some water pipe smoking?
It's hard to do direct head-to-head comparisons because people smoke them in different ways. I mean, I've seen numbers published for one water pipe session, which remember can last for 60 to 90 minutes. There's some studies showing that's equal to smoking 100 cigarettes or 5 packs. Other studies have shown it's maybe only 3 to 10 cigarettes, and others in between. So we could argue, is it 100 or is it 10? But either way, it's bad. I sort of go with the more pragmatic answer that can't be a good thing to be smoking even 10 cigarettes at one time. There's a lot of studies on the acute effects of water pipes. So if you smoke a lot, you can get poisoned from all the carbon monoxide you're breathing in. colleagues from Lebanon have shown that, and from Virginia have shown that a lot of the same chemicals that you would get from cigarettes, you also get from water pipe. They don't have the data showing that 20 years later that causes A, B, C, D, and E, because that's a lot harder studies to do than to show that you're getting these poisonous things. There's some suggestive studies showing that it probably causes some cancers and probably causes heart disease. The review article that Greg and Kate sent the link to that we just wrote on secondhand effects of water smoke showed the same thing. It suggested it's got some of the same effects as cigarettes, but there's not 200,000 articles, there's only a few hundred, so we don't have quite the same depth of data. And that's been the big challenge with it. I was co-chair of the first International Conference on Water Pipe Tobacco Research, which was here in Abu Dhabi in October of 2013. And that synthesized the world's literature because we had pretty much all the people publishing on it in the room here in Abu Dhabi. And there's suggestive data, but it's hard to do those long-term studies. And until you have those, I'm sure the people who manufacture this stuff are going to say, well, prove to me that it's bad. You just showed that it's a bit of harm right now, but nobody's proven that it causes this, this, and this. We ended up with a statement, declaration from that, basically saying that, like cigarettes, smoking water pipe is dangerous and should be stopped. And more details on it. So I can't do the head-to-head comparison, but everything that I've seen shows that it's dangerous.
Is there any evidence or studies that smoking water pipe is harmful or dangerous? For example, like what one of our philosophists writing a story about how dangerous is cigarette in India. Bantika, your story, you have written that clearly seen that smoking cigarette is very dangerous, right? Smoking cigarettes is very dangerous because you have a picture, you have a face that represent how dangerous is smoking cigarette.
That's not smoking, that's smokeless, that's
chewing.
Chewing.
It's something like that. But do you have something similar like that where some people or someone here was dead, for example, because of smoking water pipe?
There haven't been as good studies long term. I mean, what I would love as a physician, what I would love to do is to be able to say to my patients, to the public, saying, if you smoke, you are X times more likely to die or Y times more likely to get a respiratory infection or asthma or something. And we don't have those numbers yet. The data that I was just mentioning suggests that it is bad and may be as bad in some areas, but unfortunately, I can't put a number on it yet. That's been one of the barriers in the research, and you need longer-term studies to put that number. Similarly, I can't point to Mr. Smith died because of smoking a water pipe. Those are always hard to do, and tobacco companies have always fought those kind of things, because how do you ever prove that something was due to... You can prove somebody died of lung cancer, and I can show that lung cancer is 10 or 20 times more common in cigarette smokers, but could I prove that Mr. Smith's death from lung cancer was due to smoking? Somebody might argue, well, there were always deaths from lung cancer, and maybe his wasn't smoking. So I can't say that a specific death, but it clearly seems to be dangerous from everything that we see in the literature. I just can't give you numbers yet.
I just want to know that is there any restriction on hookah bars here by the government that they said that they cannot allow hookah bar owners cannot allow teenagers to enter into the bars and access to hookah, shisha, something like this. Or no, anyone can enter and.
So the policy here is that hookah bars, I believe, have the same restriction as sales of tobacco, of cigarettes. I think here the age, and I'm not positive, but I think it's 18. You can't buy cigarettes under 18, and you also can't go into a hookah bar. That doesn't necessarily mean it's enforced, but that's the policy. When we asked owners, the response was sort of lukewarm, with some saying they enforce that and others saying they don't. When we asked in New York City, most suggested they don't enforce it, and one said they charge underage people more money. So, as I said, it's a different policy climate in New York City.
What about with e-cigarettes? Like we had a speaker yesterday who said that in the States you can get e-cigarettes in vending machines, so there's no age limit.
Right, and that's been an interesting thing as well. Is there have been a lot of move, I think, often by tobacco companies to get e-cigarettes not to follow the same rules, to not have age restrictions, to not have clean indoor air law restrictions. The latest information from the FDA, I think, suggested they should have the same age restrictions. New York City took a different approach. They basically said that every clean indoor air law that applies to cigarettes also applies to e-cigarettes. And the reason why, and I heard somebody from the Department of Health speak, was they said that most of the enforcement for the clean indoor air law in New York City banning smoking is not from the government, but from the general population, where people are like, hey, don't smoke in that bar. And if they allowed e-cigarettes in a crowded bar at night in the dark, it said it would undermine all the good enforcement that the public's been doing. But I'm worried about that as well, is that this is going to be a way to bypass some of the laws.
Can we draw a conclusion that things like a water pipe or e-cigarettes are kind of the same as a low tar or light cigarette, for which there is no safe dose and have the possibility of overdose?
So let me modify that slightly. Tobacco companies marketed their product as low tar or light, but people showed that those weren't any less harmful than regular cigarettes. That people still got lots of harmful things, and it still led to cancer and heart disease, and probably not any less bad for people than regular cigarettes. And I would say that I treat hookah the same way, is that it's likely to cause heart disease and cancer, and that there is no safe dose, that even smoking once every 2 weeks is likely to be bad for you. If you're getting in 20 or 40 cigarettes every 2 weeks, that can't be a good thing, because we know that there's lots of poisons in cigarettes that get deposited in the lungs and in the air that you're breathing in. I'm a physician, so I've spent 20 years treating the ill effects of smoking, because the system that I'm in New York City has, and when I was in Los Angeles, has a lot of older men who are suffering now from the harmful effects of cigarette smoking. And I'd hate to see stuff like that 20 years from now from water pipe.
Any other questions? Thank you, Dr. Sherman.
You're welcome. Thank you for all the questions.